Senator Amy Klobuchar's husband, who was hospitalized with the coronavirus earlier this week, has been released from the hospital. He was released yesterday. He's recovering at home. The Minnesota Democratic senator joining us now from the Senate. It's so great to see you. Who's kind of been riding this roller coaster with you emotionally, virtually. We know your husband. I know your husband, and what a wonderful, extraordinary person he is, and what a partner he was for you in life and throughout the campaign. We're so glad that he's better. I think he's 52 years old. He had a really severe, severe challenge there for a while. He was on a ventilator.
Well, he was on oxygen, and a lot of that was because he had pneumonia and he had really low oxygen. He ended up going in when he started coughing up blood, and that's when he got the test. And he just got out of the hospital. He's recovering, and he would love to go back to remotely teaching his classes. I'm not sure that they're quite ready for that, but he is. I get to wave to him out the window today because, just as Walter Isaacson was just saying in that important segment, there's just not enough information out there yet. And I agree. In 5 to 6 weeks, we're going to know a lot more about when people aren't contagious. They think he still could be because he's still coughing. And all of these things, people need this information. But right now, as you know, they need ventilators. They need help. That's why that vote is going on in the House. I find it frustrating that one member from Kentucky, Congressman Massey, can hold up this whole process, but that's what he chose to do. I'm very pleased that in the U.S. Senate we had a unanimous vote to get help out to people for unemployment, to make sure that we've got help for small businesses, and then, of course, the equipment that should have been there a long time ago, but the planning was not done when this first struck in China.
Now, you cast your vote in the Senate while your husband was in the hospital and while you were so worried about him. At this stage, what are the doctors telling you about how can they test him to make sure that it's safe for you to go home and be with him?
But no one really knows. They're just waiting to let some time pass so he's not showing the symptoms. And, you just wait. I really do want to stress, though, that our problem is so small right now compared to everyone else's who have people that are in the hospital who, like me, cannot visit those loved ones, some of them much sicker and getting sicker than he was. The seniors who are in their houses and can only have their friends and loved ones visit them through a window. All of this is happening right now, Andrea. So I think it is important to put things in perspective, to get the help out there we need federally. And just my story, if anything, I hope it's helpful for people to realize, follow the rules. And we did, but at least he didn't get me sick or other people sicker. Why? Because he followed the rules. And I think that the more people that do that, it's really, really important. You're going to save lives.
Now, of course, one of your colleagues did not follow the rules, as far as we can tell, because Rand Paul tested positive last Sunday. I think it was Sunday, after being in the Senate gym.
Yeah, well, I'm not going to comment on his situation. I just know that every time you don't follow the rules, you're putting someone else's life in danger, whether it is the healthcare workers on the front line who need that equipment, whether it's the grocery store clerk who's sitting there just getting food out to people. This has got to be a team effort. And I think leadership means making that really clear. It's a tough, tough time, and it's hard for everyone. But if we do this together, we're going to save lives. We're going to get through this together, and that's what we're doing right now. And I'm glad all those House members are coming in there to take that vote, because we need to get the relief out to the American people.
I was very struck in watching the House floor debate in seeing Ocasio-Cortez and Liz Cheney, two very disparate political wings of each of their parties, one conservative Republican, obviously, and one a very progressive Democrat, all calling for a vote in passing a bill that a lot of which they didn't like. They saw the need to compromise. And I think that is the message. What is your message now? I know you just mentioned Congressman Massey, but what would you say to him about his resistance today?
Well, I probably first tell the story about my husband and how close it was and how scary it was that this can happen to anyone, and it's going to happen to people that he knows. And the second thing I would say is that this didn't have everything that I wanted. I wanted more funding for voting at home and mail-in ballots, because that's what we're going to need in November. And I got some, but not what I wanted. But was I going to turn away and vote against that bill because of that? Absolutely not. Our cities still need more help. We're going to need more equipment out there, but we have to respond. We know that people are, through no fault of their own, being uprooted from their jobs every single day. And this is a country that has each other's backs. We have come through horrible crises before. We will come through this, but not if we play politics with it. And I think that's why you saw liberal Democrats and conservative Republicans, I would say, joining hands, not quite, that would be against the rules, but joining to support this bill. And one of the things that's also bothered me through this process, of course, is some of Donald Trump's rhetoric and the blame and not always getting the facts out. And I think people have to step back, listen to their governors, look at how we can make regional responses if we're not going to get the testing out like we should, and be the great country that we are.
Do you have some concerns that the president now is going to be pressuring the scientific advisors? There seemed to be a change in posture from Dr. Deborah Birx last night. A lot of people were concerned about some of the things she said about new modeling. The vice president said that he was going to get a report from the medical advisors this weekend as the 15 days draw to a close as to whether some parts of the country can be, go back to business.
I think we have to listen to the doctors and the scientists. Clearly, some parts are hit more than others. But what we've seen right now nationally, not just in one city, is right now we are on the ramp up of the number of cases, on the ramp up of the number of deaths. And so this isn't the time where you send this mixed message, oh, stay in your house, but don't stay in your house. I think we need a federal message. And of course, at some point, certain industries and areas, you start figuring out how they can go back to work. Of course you do. But it feels to me that it is just much more one of his, oh, let me say something out for the spur of the moment without consulting people, than it is actually a plan moving forward. And that has been the whole problem from the beginning. This is a global pandemic, Andrea. It is. But a lot of these errors that were made early on of not getting ready and the tests, those are man-made errors. But we'll have plenty of time to talk about that later.
Senator Amy Klobuchar, our best to you and your husband and your daughter and the whole family. Thank you very much.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.